She looked no different from a janitor despite her nursing uniform. Maria Rodriguez adjusted her faded blue scrubs as she entered St. Vincent Hospital's ICU corridor. Other nurses looked away when they saw her. Doctors acted like she wasn't there, and the head nurse piled all the difficult cases on her. To them, this woman was only good for menial tasks, old, slow, insignificant. But that night when an emergency code echoed through the halls, all personnel to ER, multiple trauma, panic gripped the entire hospital. Maria walked quietly, her hands automatically conducting tactical assessments, and with a single movement shocked everyone. As she approached the wounded, her posture changed, her voice shifted to command tone. And in that moment, a terrifying truth emerged. Ah, Medic 1. The combat medic who had saved lives in the Army's toughest missions, believed dead 5 years ago, was here in the hospital breathing. St. Vincent Hospital's night shift was always quiet. Only machine sounds echoed in the corridors. Occasional patient bells and the soft clicking of nurse shoes. Maria Rodriguez, 42 years old, had been working here for 10 years, but still seemed invisible. The other nurses called her Old Maria. Her hair had grayed early. Lines of fatigue marked her face. Her movements appeared slow. At least that's how they saw her. Head nurse Patricia Mills always gave her the toughest cases. Stubborn patients, difficult families, long-term care cases. Maria, room 304 is yours, Patricia would say, slight contempt in her eyes. You handle those types of patients better. The other nurses would smile as if they were doing her a great favor. Maria never objected. She'd just nod, take the file, and focus on her work. No one paid attention to how she worked. Her quick assessments, precise movements, never panicking. None of it mattered to anyone. That evening was the same routine. Maria had taken on 14 patients, an elderly man who'd had a heart attack, a woman in post-stroke rehabilitation, a young patient after appendectomy. All categorized as difficult cases. Other nurses handled VIP rooms and easy patients. Dr. Michael Stevens, Assistant Chief of Medicine, frowned when he saw Maria in the corridor. Nurse Rodriguez, room 310 is complaining. Be more careful. Maria bowed her head respectfully. Of course, doctor, I'll check right away. But Dr. Stevens had already dismissed her. Even one word was too much for Maria. To him, she was just an aging, slowing nurse waiting for retirement. No one noticed that Maria was different. They didn't see how quickly she organized during emergencies, how systematic she was when evaluating patients, how she never panicked. They only explained it as being old and experienced. Young nurse Sophie Bennett never liked working with Maria. She's so slow, she'd tell her colleagues. She examines everything in detail. Waste of time. Another nurse, Rachel Foster, would agree. Old-fashioned. Modern medicine works differently now. Maria heard these comments, but never reacted. She'd quietly do her work, keep her notes, write her reports. No one noticed the small metal badge she carried in her uniform pocket, semi-visible, old, worn piece of metal. That night was the same routine. Maria was doing her final rounds while other nurses prepared for shift change. It was 11:30 p.m. The hospital was calm. Everyone was tired. Maria, can you work an extra shift? Head nurse Patricia's voice echoed in the corridor. Elena's sick. Someone needs to cover. Maria hesitated. She'd already worked 12 hours and was tired, but she just said, sure. Young Dr. Carlos Mendez turned to his colleague when he saw Maria. I don't understand why nurses this old keep working. Slow, inefficient. Dr. Sarah Williams smiled. They say experienced, but they can't keep up with modern medicine anymore. Maria heard this, but never let it bother her. She was used to these comments now. No one knew her past. No one cared to ask. Sophie Bennett was whispering to a friend. I'm stuck working a shift with Maria. The whole night will drag. Rachel Foster agreed. We give her all the difficult patients anyway. She's not good for anything else. Maria entered room 304. An elderly man post-cardiac surgery. His family worried. Nurse, my father's very bad. The doctor isn't saying anything. Maria calmly explained the situation. Listen to the family's concerns. Perform necessary checks. Other nurses avoided dealing with these kinds of difficult families. For Maria, it was routine. Patience, understanding, professionalism, abilities no one noticed. Midnight was approaching. The hospital had grown even quieter. As Maria made her final rounds, she touched the small metal badge in her jacket pocket. Worn, old, nearly invisible, but it meant everything to her. Young nurses had gathered in the corridor talking. I don't understand how she works at this age, said one. She should retire. Another added, she can't even use modern equipment. Show her a tablet and she'd be confused. Maria passed by them, said hello, quietly continued. To them, she was invisible now, just an old, slow, outdated nurse. At 12:15 a.m., the hospital intercom crackled. All personnel to ER, multiple trauma, code red. The tone was serious, urgent. The emergency call repeated. Multiple trauma. ICU personnel to ER. All nurses started running. Maria also began walking but differently. Her steps changed. Her posture changed. Her eyes began scanning the environment as if an automatic system had activated. Reflexes learned 15 years ago were coming alive. When she reached the ER, there was chaos. Traffic accident. 2 cars collided, 5 injured, 1 critical. Ambulances kept arriving, doctors running around, nurses in panic. What do we do? Sophie asked in panic. So many injured, Rachel was the same. Where's Dr. Stevens? Dr. Mendez can't handle this alone. Maria assessed the situation at a glance. Trauma procedures came alive in her mind. Multiple casualty triage, prioritization, resource management, systematic approach. Sophie, you check that patient. Rachel, you handle records, Maria said calmly but decisively. Sophie was shocked. This wasn't the Maria she knew at all. First patient, 25-year-old woman, conscious, broken arm, stable. Second patient, 40-year-old man, chest trauma, can't breathe. Critical. Third patient, 16-year-old, head trauma, unconscious. Emergency intervention needed. The triage protocol was running in Maria's mind. Red, urgent, yellow, non-urgent, green, minor. The system she'd learned in Afghanistan 15 years ago. The most severely injured was a 35-year-old man. Multiple trauma, suspected internal bleeding, unconscious. Dr. Mendez was panicking. We're going to lose him. Or is it ready? Anesthesiologist hasn't arrived. Maria knelt beside the patient. Pulse weak, blood pressure low, signs of shock. She assessed the condition. Hemorrhagic shock, probably splenic rupture. Let's get 4 access. Start fluid resuscitation. Dr. Mendez was surprised. Nurse Rodriguez, how do you? Maria didn't answer. She placed her hands on the patient, began systematic examination. Abdomen rigid, guarding present. Internal bleeding certain. 14 gauge 4 cannula. Ringers lactate fast, Maria said. Sophie brought the supplies trembling. Maria's hands were precise, never shaking, every movement planned. Nurse, how do you know such detailed examination? Asked Dr. Mendez. Maria hesitated. Time had come to reveal the truth she'd hidden for 10 years. Field medic training, she said quietly. Army, 15 years. Everyone around stopped. Sophie's mouth fell open. Rachel couldn't believe it. Dr. Mendez's expression changed. Which unit? Dr. Mendez asked. Maria hesitated. 68th Combat Support Hospital, Afghanistan, Iraq. Were you a combat medic? Dr. Mendez's voice was now filled with respect. Maria nodded. 15 years active duty forward surgical team. Medic 1 was my call sign. Everyone around was shocked. Who could have known that old, slow Maria was a combat medic? Sophie whispered, "This is impossible." But Maria didn't stop now. The patient's condition was worsening. "Need rapid sequence intubation," she said. "Flight time." She turned to Dr. Mendez. "Doctor, may I assist?" For the next hour, Maria's true ability emerged. Triage, resuscitation, emergency interventions. She was coordinating everything. Sophie and Rachel were following her instructions. Dr. Mendez was consulting with her. "Nurse Rodriguez," said Dr. Mendez, "where did you learn this level of medical knowledge?" Maria explained while connecting 4 to the patient's vein. "Advanced Trauma Life Support Tactical Combat Casualty Care Field Surgery. The Army gives the best training." The second patient was a young person who'd lost consciousness, head trauma, variable pupil reflexes. Maria began neurological examination. Glasgow Coma Scale 8. Possible increased intracranial pressure. Dr. Mendez was amazed. "How are you performing this examination?" Maria explained, "I have a lot of experience with IED explosions, TBI cases. I specialize in blast injuries." Sophie couldn't believe it. "Maria, were you really in war?" Maria placed her hand on the young patient's head. "Kandahar, Helmand, Ramadi, 3 tours, 187 critical patients." Rachel's voice was shaking. "Why didn't you ever tell us?" Maria continued working quietly. "Wasn't asked. The past doesn't matter. Now matters." Dr. Mendez looked at Maria with new eyes. "Nurse Rodriguez, sorry. What rank did you hold?" Maria hesitated. "Staff Sergeant, Combat Medic Badge, Bronze Star, Purple Heart." Silence, the surroundings seemed frozen. When Chief of Medicine, Dr. Harrison, arrived at the ER, the situation was under control. All patients had been stabilized and were being prepared for surgery. "Who coordinated this triage?" he asked. Dr. Mendez pointed to Maria. "Nurse Rodriguez, but actually she's a former combat medic. Incredible experience." Dr. Harrison turned to Maria. "Really? Which unit were you with?" Maria respectfully answered 68th CSH Afghanistan. "Forward Surgical Team." Dr. Harrison's expression changed. "I was there too at Bagram 2007 to 2009. I might know you." Maria smiled. "I was active 2006 to 2021. 3 tours. 15 years. Dr. Harrison's voice was filled with admiration. "Why didn't you tell us?" Maria shrugged. "The past is the past. I'm a nurse now." Sophie approached. "Maria, I'm sorry. I never really knew you." Maria put her hand on Sophie's shoulder. "Don't worry about the past. What matters is now working together." The next morning, the hospital had changed from top to bottom. Maria's story had spread. Everyone was talking, but Maria was the same, calm, focused on her work. Head nurse Patricia came to apologize. "Maria, if I had known, why didn't you ever tell us?" Maria smiled. "It wasn't important. Until last night." Dr. Stevens. Very different from his previous dismissive attitude. "Staff Sergeant Rodriguez, if you're available, would you be an advisor to our trauma team?" Maria thought, "Can I continue working as a nurse?" "Of course, but now we'll also benefit from your expertise." Sophie and Rachel came over. "Maria," Sophie said, "are there things we can learn from you?" Maria smiled. "Always. But you'll also teach me modern protocols. That's how teamwork works." Walking through the hospital corridor, Maria touched the badge in her pocket. She no longer needed to hide it. Staff Sergeant Maria Rodriguez, Combat Medic Badge, had finally made peace with both her past and present. All 5 patients saved that night were in recovery. Dr. Mendez thanked Maria. "With your coordination, we didn't lose anyone. This is incredible." Maria nodded. "Teamwork. No one can do anything alone." 3 days later, hospital management offered Maria a special position, trauma coordinator, responsible for both nursing and training. I accept, Maria said. But I have conditions. I want Sophie and Rachel on my team, too. They have potential. 6 months later, St. Vincent Hospital's trauma service had become one of the best in the region. Under Maria's leadership, young nurses were learning advanced life support. Doctors were getting acquainted with military triage techniques. Sophie was now Maria's closest colleague. I learned something new from her every day. Her combat experience is very useful here. Rachel agreed. She never panics, finds solutions in every situation. One evening, Maria sat in her office looking at the new framed photo on the wall, her unit in Afghanistan. Young people laughing, looking toward an unknown future. Below it, a new frame. St. Vincent Hospital Trauma Team. Maria in the center. Sophie and Rachel beside her, Dr. Mendez and Dr. Harrison in the back. 2 lives merged. The past was no longer a burden, but strength.